This is my presentation on meningitis. Meningitis is inflammation of the protective membrane. Swelling is usually caused by a bacterial or viral infection of the fluid. There are many different types of meningitis. It can also be caused by injuries, cancers, and certain drugs. Signs and symptoms of bacterial meningitis include headache, stiff neck, photophobia, fever, vomiting, nausea, and altered mental status. Signs and symptoms of viral meningitis include sleepiness or trouble waking from sleep, lack of energy, fever, and altered mental status. Non-infectious meningitis is due to pathogens that spread between people that are called infectious diseases. Other causes may include cancer, lupus, certain medicines, head injuries, or brain surgery. Signs and symptoms of non-infectious meningitis include headache, fever, stiff neck, vomiting, and nausea. Young children and adults over the age of 65 are at the highest risk of getting bacterial meningitis. 21% of all meningitis disease cases occur in preteens, teens, and young adults ages 11 to 24. In African countries with high rates of HIV infection are the majority of meningitis cases and have been associated with the highest mortality rates. Where you live can influence the risk of meningitis. Traveling abroad may increase the risk of exposure of the cause bacteria. Highest risk of catching meningitis in the world is an area of sub-Africa known as the meningitis belt. This area stretches from Senegal to Ethiopia and is prone to massive breakouts. 13,974 cases of bacterial meningitis were reported to the CDC from 27 states in the United States from 1971 to 1981. In 1995, the rates of incidence of bacterial meningitis drastically declined as a direct result of meningitis vaccine. Meningitis is increasing in patients that are using NSAIDs and that also have underlying autoimmune diseases. Ibuprofen is the most common culprit identified and is most frequently implicated for drug-induced aseptic meningitis. Signs and symptoms of NSAID-induced meningitis may become evident a few minutes to several hours after intake of meningitis and risky behaviors include smoking or secondhand smoke, drinking, activities that weaken the immune system, coming in contact with someone else's oral respiratory secretions, college students, international travelers, and a person that has AIDS. Primary prevention includes knowing and understanding the population at risk. People who smoke, have HIV or AIDS, and babies are all at higher risk. Secondary and tertiary preventions include early detection, prevention, and treatment of meningitis. Doctors can treat bacterial meningitis with a number of antibiotics. Vaccines are the most effective way to protect yourself against certain types of meningitis.